Hey everybody, welcome to our O'Neill Marketing Summer of Training webinar. We have enjoyed offering bi-weekly webinars to keep our agents engaged and educated. Today we welcome the Carrier Friday. Kylie Everhart will be presenting and will share with us what we can expect from Friday, what Friday is offering for the 2021 plan year. We'll be having minor details of 2022 OEP. As we listen to this presentation, we encourage you to type in any questions you might have along the way. We will leave time at the end of the presentation to address your question and comments. Kylie, the floor is yours.
Thank you, Matt. I appreciate it. Good morning, everyone. Thank you very much for allowing me to spend some time with you today. My name is Kylie Everhart. I am the Director of Sales for Friday Health Plans here in Texas, but I will be talking about the entire country. And so we'll get started. Thank you again to O'Neill Marketing for being a wonderful partner of Friday Health Plans. Let's move forward here. So we'll go over Friday Health Plans 2021. Since I am the Texas director, I am going to take over the imagery, and I like cows. So there you go. As Matt said, please feel free to pop any questions into the chat box if they come up. Today, we'll go a little bit about Friday Health Plans, our service and expansion areas. I'll review our 2021 benefits and touch slightly on the 2022 benefits, reviewing our network, quoting and enrollment, where we can find sales materials, and our broker support unit. Just a little bit about Friday Health Plans. The brand itself was founded in 2015 by Sal Gentile and Dave Pinkert. They said health insurance should provide peace of mind and be worry-free, making every day feel like Friday. That's where our name came from. In 2017, we acquired Colorado Choice Health Plans, which is a 45-year-old company based out of Alamosa, Colorado. What that gives us is a very unique position in the market of a new, fresh, innovative brand backed by 45 years of experience in underwriting, actuary, claims, customer service, broker support. And with that, we do keep it simple. Operational efficiency, top-notch customer service, and broker support are really core to our brand. Some facts to know: our 2021 Net Promoter Score is a 26. That is an increase by 4 points since last year. Just so you're aware, the industry average for Net Promoter Score is 8. So we're doing pretty good there. What that means, if you're unfamiliar, is that our customers really like us and they are willing to promote Friday on our behalf. We've done $210 million of funding for expansion. $160 million was our last round. Grown our membership by 400%. We will be in 7 states for 2022. We were in 4 states for 2021. And the number of employees that we have as of June 2021 is 290. Getting a little bit deeper into our Net Promoter Score, again, it was 26 this year. It was a 22 last year. Industry average is 8. But our brokered customers really like us. So brokered customers come to us with far more education and support. And so our Net Promoter Score among our brokered members is a 38, which is great. That's why we value you all so much. You are doing wonderful work. Are there any questions so far? Don't think that we do. No? Cool. Okay, where we are. So for 2021, we are in Colorado, of course, Nevada, New Mexico, and the great state of Texas. And for 22, we are expanding into Oklahoma, Georgia, and North Carolina. We are still pending approval in Georgia and North Carolina for our license. We cover the majority of counties in Colorado, so primarily through the southeast and then over to the west. In Nevada, we are statewide, as well as New Mexico. And in Texas, we offer currently for 2021, the 7 largest counties. So that is the DFW and Tarrant and Dallas, Austin and Travis County, San Antonio and Bexar County, Houston and Harris County, Lubbock County, and El Paso County. For those of you who are unfamiliar with the Texas geography, the county of Harris, which is Houston, has 2 million more people than the state of Colorado. So it looks a little sad when you look at it on a map, but there's a lot of people available in these counties. And then again, for 2022 in Texas, this has been approved by TDI, the Texas Department of Insurance. We are expanding into 13 additional counties. So around the DFW metro, we're going into Grayson, Denton, Collin, and Ellis. Around the Austin metro, we're adding Williamson. Around the Houston metro, adding Montgomery, Fort Bend, Brazoria. And then we're entering the Rio Grande Valley and Coastal Bend area into Nueces County, which is Corpus Christi, Cameron County, which is Brownsville, Hidalgo County, which is McAllen, Starr County, and Webb County, which is Laredo. No questions here? Okay. Our 2021 benefits. So these are our highlights. We really value $0 benefits. We want to remove those barriers to care. So on many of our plans, $0 unlimited primary care visits. Of course, that $0 annual wellness exam. I'm aware that those are mandated, but research shows that many people still, after the ACA has come into play, don't know that they can get an annual wellness exam for no money. $0 annual unlimited mental health visits. Mental health is just as important as your physical well-being. If the pandemic has shown us anything with people being isolated, that is so very, very, very important. And we offer $0 preferred generics on many of our plans and have about 5,000 $0 preferred generics on our formulary. We also offer $0 teledoc services and $0 virtual mental health through Sondermind, and urgent care clinics at a $75 copay before deductible on many of our plans. So I'm going to need y'all's help just a minute for this next slide because it's new for me. I embedded one of our commercials. So if you would just put in the chat box if you can or cannot hear it. You're my guinea pigs today and I appreciate it. Were you able to hear that? No, you could not. All right, Mike, thank you very much for letting me know. We will figure that out. It's a funny commercial. It's on YouTube. You can find it. So getting into our plans. Our Friday bronze plans, these are for basic coverage. We have 3 levels of bronze. There's the bronze HSA, and the bronze plus. So on the bronze plans, that is a very traditional bronze for 2021, $8,550 deductible for the individual, $17,100 for the family. The out-of-pocket max does mirror that. If you noticed on all of our plans, teledoc is always going to be $0. Doesn't matter which plan it is, teledoc is $0, as is the annual wellness visit. On that basic bronze plan, aside from those 2 items, it is subject to deductible, then covered 100% after deductible. On the bronze HSA, again, traditional HSA plan, $6,900 individual deductible, $13,800 for the family. Out-of-pocket max does mirror. On the bronze plus plan, this is where we see a differentiator in the bronze. So the bronze plus, $8,550 deductible, $17,100 for the family. Out-of-pocket max does mirror. The primary cares, $0. Mental health, $0. Teledoc, $0. Urgent care, $75 per visit copay, and preferred generics up to $25 copay. Now in New Mexico, on the Bronze Plus, the primary care is a $20 copay only in New Mexico. All other states are $0. Questions on the bronze plans before I move into Colorado's bronze plans? Okay. In Colorado, the bronze and the bronze HSA are the same. In Colorado, we have what's called the Bronze RX copay plan. So very similar to the Bronze Plus, still those $0 benefits. The difference in here is the copays on the RX. So again, the preferred generic up to $25, preferred brand up to $250, non-preferred generic brand up to $350, and specialty up to $710 copay.
I need to share that.
Say again, please. Didn't quite catch that. Could you say that again?
I'm not too sure what that was. I think it was Chuck just joined. Sorry about that.
Okay, no worries. Moving into our silver plans. So the silver plan for Nevada, New Mexico, and Texas is $5,500 individual deductible, $11,000 for the family. Out-of-pocket max $8,550, $17,100 for the family. Very similar to the Bronze Plus, $0 primary care, mental health, teledoc, annual wellness exam, $75 copay for urgent care. It is a 20% co-insurance, except for that emergency room. And then that does bring these preferred generics down to $0. In Colorado, the same silver plan does exist. And then we also have the silver RX copay. Again, this is just for the RX copays. That preferred generic drops down to $0. And then a copay for preferred brand, non-preferred generic or brand specialty drugs up to $250, $350, or $710 copay. And then our gold plan. In Nevada, New Mexico, Texas, $2,300 individual deductible, $4,600 for the family, $8,250 for the out-of-pocket max, $16,500 for the family. Aside from that, exactly the same as our silver plan. One interesting item on the gold plan is that if you are looking at a non-CSR silver, so an individual who is subsidy eligible but does not qualify for cost sharing reductions, the gold plan in Texas is going to be less expensive than the least expensive silver plan, regardless of carrier. And in Colorado, we add in the gold RX copay. So the other benefits are the same. The gold RX copay, again, $0 for the preferred generic, up to $250 for preferred brand, $350 for non-preferred generic brand, or up to $685 for specialty drugs. Now, a little snippet of 2022. We are adding 3 new plans to the individual market at bronze, silver, and gold. And those are our bronze, silver, and gold copay plans that will start adding in items like specialty copays. Copays for x-ray and lab work, different copays for the prescriptions, so lower copays on the prescriptions, just enhanced benefits. And we can go over those when we do have our training on the 2022 plans. Any questions on the plans before I move on from that? Y'all are making this easy on me. Okay. Additional benefits, we've already talked about the teledoc, that is virtual doctor visits 24/7, always at a $0 copay, regardless of the plan that they're on. Urgent care, we have Dispatch Health for urgent care. That's in several of our markets. In Texas, that's Dallas, Fort Worth, Austin, San Antonio, Houston. That is urgent care that comes to your home, and it follows the same copay as urgent care. For 2022, we are adding a Colorado benefit to all of our plans. That is one free annual wellness visit exam through VSP. Sondermind is our virtual mental health visit provider. And then we offer our national access program. That is for out-of-area dependent students. So if one of your client students is going to school outside of one of our service areas, they can hop on the national access program. And also employees for small groups who live outside of the service area. Okay. We offer a member mobile app. So the features on that are the deductible snapshot, claims. They can view and download their ID card, search for providers, search for drugs, and also annual health plan renewal process. So they can renew their plan through their member app. Provider network here in Texas. We have, let's see here, did I add these in? No, I didn't. Okay. So for the provider network in Texas, we have several of the large, excuse me. Several of the large hospital systems. So HCA Houston Healthcare, Texas Children's, Oak Bend Medical, Methodist, Doctors Hospital of Laredo, Starr County Memorial Hospital, Valley Regional Medical Center, Corpus Christi Medical Center, Texoma Medical Center, Medical City Medical Center, UMC Health Systems, Las Palmas del Sol, and St. David's are the primary hospital systems here in Texas. Let's see here. I apologize for some technical difficulties. Give me just a moment. Texas. Okay, well, we'll move on. And then we can also look at our provider network through our website at fridayhealthplans.com. For quoting and enrollment, for the individual and family plans, you can enroll directly through our website, healthcare.gov, Connect for Health Colorado, Be Healthy New Mexico, Nevada Health Link, and then we're also on all of the EDE platforms. So Health Sherpa, Benefit Align, Quote It, all of the platforms that have an EDE contract with CMS. For small group, you can quote through Friday Health Plan Small Group Sales Executive, Xywave, Ease, Perfect Quote, Gusto, Benefiter, several other platforms. I'm not sure what platform you all use if you do group. For sales materials, those are also available on our website with no login required. Oh, it didn't move forward. I apologize for that. So our broker hub on fridayhealthplans.com, all of the materials that we have for each state are there. So that's brochures, applications, the formularies, service area maps, partner information, contact lists for all of the sales executives and the sales directors are available. We have our Friday Care Crew. This is where we get that Net Promoter Score, is our care crew that are based in Alamosa, Colorado. So they do have that hometown feel available for whenever your clients call in. All of our employees are in the same building, and they all live in the same town. So they can answer questions about coverage, benefits, claims, billing, anything that they have questions about. And then our broker support unit. So we do have a designated broker support unit just for you. Their telephone number, 844-270-7075, or email at brokers@fridayhealthplans.com. They can answer several questions: appointment, the portal, network, claims. This is the best way to get your questions answered quickly. However, our sales executives are available in each state to also answer your questions. We do have local representation in every state. I have 7 sales executives for Texas. Colorado has 2. New Mexico, Nevada each have 2. Georgia, North Carolina, Oklahoma will also have sales executives available. And that's all. What questions do you all have for me? Anything?
All right. Oh, there
Okay.
we go. I'm trying to get some. So there's a question: what states will you be in next year? I don't know if you can disclose that, but I remember the map.
Yes. So in addition to Colorado, Nevada, New Mexico, Texas, we will also be in Oklahoma, Georgia, and North Carolina. Yes, of course, Mary. Thank you. Any other questions? Doesn't even have to be a question about Friday.
Well, they wait for, if we'll wait a couple more seconds for questions, but
That's
one thing
fine.
I did catch that I loved is I love the student plan. I get asked that all the time. People are always asking, like, what do I do with my kids? They're going away to college.
Yes.
That was crazy. And you even just addressed it like that too, knowing right up front that you guys are aware that that is a huge issue.
It is. I mean, my husband and I just sent our oldest daughter off to college last weekend, and she'll be in a service area that we don't cover. So I'm super happy for that national access program. Okay, not familiar with Friday. How big is your provider network? So we build our network in a very specific way. So we are more narrow at the top where it comes to high cost specialists and hospitals, and wider at the bottom where we have primary cares, OB-GYNs, pediatricians, and mental health. And so in Colorado, what state are you in, Edith? Or where do you work?
I can answer. I'm for a couple of Edith's in a couple states. She's big in Florida, but I know she's also in Texas. Um, I think Georgia as well. Those are a couple off the top of my head.
So we can go through, I mean, in Texas, we have a great network, and we're constantly building. This is also one area that we really excel in as like I said, a newer brand with deep roots. If there is a provider that you need that is not in our network, we do take nominations all the time. So, we're always adding to that network. We have, I mean, just off the top of my head, because I was working on a Dallas presentation this morning, 582 primary cares in Dallas County. Really great access to imaging, primary care specialists. So the network is really good. Let me see here. There it is. There we go. This is what I needed. Okay. In Colorado, We have, again, major systems: SCL Health, National Jewish, Banner Health, Children's Hospital of Colorado. Oh, Edith, back to Texas real quick. I'm sorry to jump around like that. We are currently the only on-exchange carrier that offers both Texas Children's and Cook Children's. And so that's a huge draw for those families because, again, we are the only on-exchange individual carrier that has those in network. Back to Colorado, like Concentra for urgent care, Boulder Community Hospital. Over to Nevada, Care Now Urgent Care. Care Now will be entering the Texas network with, so far it's going to be a 10-1 effective, but that might change. But it will be in before the next open enrollment. UMC Children's, Sunrise Hospital Medical Center. New Mexico Presbyterian, which is a statewide network. One of the largest in New Mexico. There's really only two. There's Presbyterian and there's Loveless. And so we have Presbyterian. So really a good selection of doctors for your clients.